this point. If you joined us later, don't worry, I will upload this video, and at least tomorrow and on Sunday you can rewatch it again, and you will, if you will have enough time, you can repeat some points from our workshop today. So first of all, my usual question, do you hear me clearly, loudly?
Yes, sir.
Yes, sir.
Perfect. So the same strategy, the same structure of our meeting, that's the workshop. If we have this workshop, it means that we have some kind of interaction. So as usually, I'm proposing you the questions, and you will try to respond them directly to the chat. So please use the chat. If you want to tell me something, yeah, for sure, you can use the microscope if there is some critical situation and your your teacher lost his mind and just out of topic. So please shake me, but predominantly please use the chat, okay? So let's start. We are back into Krok 1 using our time machine because, you know, Marty McFly is telling you, hurry up, your exam is only 4 days away. So don't panic, but be focused and be concentrated. So now we are in 2017. In 2017, we got 24 MCQs I collected from there. In fact, 6 of them we already discussed in 2 previous meetings in 2018 and 2019. So that's why here I will present you 19 questions. And the first one from 2017, that's about the body of 37-year-old woman who died with signs of pulmonary edema. There was detected acute deformation of the aortic valve. It is shortened, thickened, ulcerated. It has areas of stone-like density. On its external surface, there are large, up to 2 centimeter in diameter thrombotic plaques. Left ventricle wall is 2.2 centimeter thick. Cardiac muscle is dull, matte, and flaccid. What type of endocarditis corresponds with described alterations of the aortic valve? So you see the gross image, and now you see the options. What is that? Your answers. You see the key points: acute deformation of the aortic valve, ulceration, and formation of the thrombotic plaques. So what is that? You propose me C, and exactly this is the ulcerative polypoid endocarditis. That's correct. Yes, please. Okay. I guess that's clear. Ulcerative polypoid endocarditis, and in fact, the name of this process in the Western School of Pathology, that's infective endocarditis. In our case, that's ulcerative polypoid endocarditis. The next question, that's about the bronchoscopy. Then there is a polypoid growth 1.0 centimeter in diameter, with ulceration in its center in the upper lobe of the right lung. Histological investigation revealed a tumor composed of lymphocyte-like cells, which means small cells, right, with hyperchromic nuclei, and the cells form layers and bands or sheets. So what is the most likely tumor type is here? So the options are here. Is it the squamous cell carcinoma? Is it adenocarcinoma, glandular squamous cell carcinoma, undifferentiated small cell carcinoma, or undifferentiated large cell carcinoma? What is this? Okay, you proposed D, which is true. That's undifferentiated small cell carcinoma. The keyword, that's lymphocyte-like cells. That's the true keyword, which means the small cells, and that's the definition of that small cell carcinoma. That's undifferentiated because, in fact, there is nothing like the normal, or at least something resembling the normal structure of the epithelium or epithelial layers. The next question, quite simple. At the post-mortem examination, the stomach of a patient with renal failure was found to have a yellow-brown coating on the thickened mucosa. The coating was firmly adhering to its surface and had significant thickness. Microscopy revealed congestion and necrosis of mucosal and submucosal layers. There is a fibrin presence. What is the most likely diagnosis, please? Okay, you propose E. E, that's the diphtheric gastritis, and that's true. What is the logic here? The renal failure leads to that mucosa and serosa take over the function of excretion. So kidneys just cannot excrete metabolites anymore. That's why some toxic substances like urea or some others, they just perform the injury of the mucosa, serosa, and in such a way we see the development of the fibrinous inflammation on the mucosa on different localization, and particularly in this case in the stomach. So in this case we have deal with the particular type of the subtype of fibrinous inflammation, and then we see the key things associated with this kind of inflammation. You know that there are diphtheric and Krupos inflammation, like of fibrinous kind, but when you have deal with the firmly adherence to the surface of mucosa, you see the significant thickness, and on microscopy you see the significant layer of the necrosis. You have to conclude that this is the diphtheric inflammation, but not Krupos. In case of Krupos, we can remove fibrin films very easily, but not in this case. In this case, we have deal with the hardly removing films. That's diphtheric gastritis for sure. The next question. After mushroom poisoning, the patient developed signs of acute hepatic failure, leading to his death. On autopsy, the liver is diminished, flaccid, the capsule is wrinkled, the tissue is ochre yellow in section. Microscopically, fatty degeneration of hepatocytes, necrotic central segments of the hepatic lobes. These changes are characteristic of, you see the histological image, and the options are here. Acute productive hepatitis, hepatolenticular degeneration, massive progressive necrosis, fatty hepatosis. What else? You propose me C, massive progressive necrosis. Perfect. That's exactly what they are talking about. For sure, there's a direct connection. Necrotic central segments of the hepatic lobes. That's it. Nothing else. You see the acute hepatitis, hepatolenticular degeneration, which is the sign of the manifestation of the Wilson's disease, fatty hepatosis, acute exudative hepatitis, which doesn't exist in fact. None of them doesn't reveal the presence of necrotic changes, especially massive necrotic changes. That's why only the massive progressive necrosis of the liver, that's the correct answer. The next one is easy. 37-year-old man who was working in a caisson after being lifted to the surface suddenly developed signs of acute cerebral circulation disturbance. Acute cerebral circulation disturbance here is the most important key point. Then loss of consciousness, and several days later he died. On autopsy in the left cerebral hemisphere was detected a gray softening, gray soft irregular focus, 5 to 3.5 centimeter in size. What is the process described here? For sure, that's ischemic stroke. Just don't waste our time. Ischemic stroke due to the gas embolism injury. of the brain, and this embolic injury led to the ischemic injury, and finally we see the development of the great softening, which is the morphological equivalent of the ischemic stroke. Okay, so we have a quite scary image here. You see the autopsy of the skull, cranium, and skull cranium removed, and you see the some kind of the hemorrhagic injury of the brain. But what is this? It was about the worker of an agricultural enterprise, and he had been suffering from an acute disease with aggravating intoxication signs, which resulted in his death. On autopsy, the spleen is enlarged, flaccid, dark cherry red on section, yields excessive pulp scrape, soft meninges on the fornix and base of the brain are edematous and saturated with blood, cardinal's cap. Microscopically, cirrhosis, hemorrhagic inflammation of meninges and cerebral tissue. Make the diagnosis. What's that? Is it the anthrax or tularemia or just plaque, cholera or brucellosis? Okay, for sure, that's A. The conclusion is pretty logic. You see, the agricultural enterprise is associated with the anthrax bacillus, as well as with the tularemia, plague, or brucellosis, but the aggravating intoxication, very severe intoxication, and the development of the cirrhosis, hemorrhagic inflammation, that's the characteristical features of this type of the bacteria, in contrast to others. That's the anthrax for sure. The next question. Brain autopsy revealed an edema, hyperemia, and small hemorrhages in the medulla oblongata. Microscopically, chromatolysis, hydropia, and nerve cell necrosis are observed. Within the cytoplasm of hippocampal nerve cell, there are eosinophilic structures, like you see on this image, directly in the neurons, and that's so-called Negri bodies. What diagnosis corresponds with described morphological sites? And you have to choose one of these options: encephalitis, encephalomyelitis, brucellosis, rabies, meningococcal meningitis, Vedica B, encephalomyelitis, Swati B, encephalomyelitis. Okay. Sorry, no. I didn't scroll down the chat, sorry. D, sure, D. That's D. Negri bodies, only thing which is directly suggesting us to the rabies. Sure, that's rabies, a viral infection. In fact, that's encephalitis, but since we have the specific name of this disease, we have to choose more specific term. So rabies, that's the correct answer. After sensitization, a test animal received subcutaneously a dose of antigen. At the site of injection, a fibrinous inflammation developed with alteration of vessel walls, basal substance, and fibrostructures of connective tissue. The inflammation took form of mucoid and fibrinoid degeneration, fibrinoid necrosis. Which immune response, which type of the immunopathological process occurred in the test animal? So what is this? Normergic reaction, granulomatosis, immediate hypersensitivity, delayed hypersensitivity, or transplantation immune reaction? What is this? I'm just scrolling down. You have to C. Sure, C, there's a correct answer. The logic is following. For sure, that's not normergic reaction, because we have deal with the sensitization and antigen interaction with antigen. That's why that's no normergic reaction anymore, because there is a sensitization. The next point, this is not the transplantation immune reaction, because there is no transplant here, right? There is no grafting. What about the granulomatosis? Did you find some description of granuloma? No, nothing like that. Instead, we have deal with the choice between delayed hypersensitivity reaction or immediate hypersensitivity reaction. See, without any particularization here, which type, first, second, or third. We just have to say that this is the delayed or immediate. Since we have deal, that just a tip, if we have deal with the exudative, which means acute inflammation, non-proliferative inflammation, which means no involvement of macrophages, that means that we have deal with a rather immediate type of hypersensitivity than delayed type of hypersensitivity. And that's true because I just can't give you any example of, for example, suppurative inflammation with delayed type of hypersensitivity, or fibrinoid necrosis development associated with the delayed type of hypersensitivity. That mostly the immediate type of hypersensitivity reaction. 7-year-old boy died of acute post-hemorrhagic anemia caused by profuse hemorrhage in the gastrointestinal tract. Post-mortem study revealed the following. Microscopically, there were acutely enlarged various groups of the lymph nodes, thymomegaly, hepatosplenomegaly, and bright red bone marrow. Microscopically, there was hypercellular bone marrow with monomorphose. What did you answer? You already started to answer. Okay. Oh. No, wait. You see the monomorphic infiltration composed of blasts and diffuse focal tumor infiltration in the liver, spleen, lymph nodes, brain substance, and tunics mucosa. Make the diagnosis. So you see the involvement of the lymph nodes. You see the blasts, and you see the age, 7-year-old. And that's for sure acute lymphoblastic leukemia. That's acute lymphoblastic leukemia. Just to explain this, I want to show you the old good cartoon from the Med Comics. That's the correct answer, acute lymphoblastic leukemia. Do you remember that? That poor boy with the blasts, with the bleeding, with the anemia. See, that's the most common pediatric cancer, acute lymphoblastic leukemia. And see, you have to associate that exactly with this kind of the leukemia, not myeloblastic. 40-year-old prisoner died of tuberculosis in the corrective labor camp. Autopsy of the body revealed deformation and diminution of both lung apices. In the both upper lobes, there are multiple cavities with dense walls. In the lower lungs, lobes were a disseminated foci of caseous necrosis, varying from 5 mm to 2 cm in diameter. Diagnose the type of the tuberculosis. That's quite easy with the bold, the words in bold as the keywords. For sure, that's tuberculosis. There are no other options. For sure, that's not primary, because primary tuberculosis is associated with the solitary single affect, primary affect, right? We got multiple injury already. So multiple cavities and dense walls, cavities and walls of fibrous tissue. Just playing with words. Fibrocavitary tuberculosis is more logic in this case. Even if you don't know the topic of tuberculosis, just catch these keywords: fibrosis, fibrotic walls, and the cavities, fibrocavitary tuberculosis. In case of the cirrhotic tuberculosis, you won't see some kind of the cavities. You will see rather cirrhotic changes in the lungs. So lungs are deformed and diminished, like in the apices over here. But in case of the cirrhotic tuberculosis, that's overtaken entire lungs. So, and for sure, that's the That's not the fibrous focal tuberculosis because we have deal with the cavities. D is correct answer. Okay, now you see the question that we didn't discuss on Tuesday, because on Tuesdays, you remember, I have chosen questions from 2009. So today I discussed about this question because it also appeared in 2017 brochure, and that's the first time traveler. A young man, and I mean time traveler MCQ, a young man came to a hospital with complaints of disturbed urination and young man. Examination of his external genitalia revealed the urethra to be split on the top, with urine flowing out of this opening. What type of external genitalia maldevelopment is observed in this case? Okay, if we have deal with the Epispadiasis, that's the only choice, then we see the formation of the splitting of the urethra. This is like the MCQ, then you must know terminology. That just, there is no other connections, just must know that. Epi means above, epispadium, that's the structure on the glans penis. And if we have the epispadiasis, this structure is just closing and splitting the urethra mouth. In case of hypospadiasis, we would rather see the deformation of the glans penis. In case of the phimosis and paraphimosis, we see the fusion on the glans penis. And in case of hermaphroditism, that's completely something out of this topic. So that's why epispadiasis, this is the genital abnormality, which is exactly associated with the closing and splitting the urethra and the disturbed urination in this case. So our disturbed urination could be connected with all others, but splitting on the top urethra, splitted urethra, that's exactly the epispadiasis. Autopsy of 9-year-old child shows numerous irregular defects of varying depth, with uneven margins at gray-white films tightly attached to the underlying tissue on the rectal mucosa. Maybe you remember the some of the MCQs that we mentioned above. It was diphtheric inflammation, right? But in this case, we have deal with some specific infectious disease. The truth that the name of this disease is the shigellosis, Shigella dysentery. But as I already told you on our previous meeting, there is the specific Ukrainian English. So specific Ukrainian medical English. What you just have to memorize, pass Krok 1, and then probably forgot about that, because you will need the normal proper words to describe these pathological processes in English. So you have to remember that this is the dysentery. In this case, dysentery means the Shigellose dysentery, shigellosis. Okay. Next question, that's about a 40-year-old woman. She has undergone thyroidectomy. Histological study of thyroid gland found the follicles to be of different size and contain foamy colloid. In fact, that's the resorption vacuoles. Follicle epithelium is tall and forms papilla. You see the papillary structures here, but that's not the papillary cancer. That's something different. There is focal lymphocytic infiltration in the stroma, just focal, not really prominent. Diagnose the thyroid gland disease. Yeah, Ayush Gayal, that's and others, also Kudrat, you wrote Bazidov's goiter. Bazidov's disease, or as you maybe remember, the more useful word in English, that's the Graves' disease, right? That's exactly the Bazidov's disease or Graves' disease or Bazidov's goiter. That's the correct answer, B, correct. Next one, on autopsy, the dissector, or prosector, as you wish, or pathology anatomist, determined that the lungs are enlarged, pale, soft, do not deflate, crunch, then cut. Microscopically, there are dilated alveolar ducts, alveolar septa are thin, and signs of intracapillary sclerosis are observed. Which pulmonary disorder are this presentation characteristic of? C, for sure. Yeah, the lungs are not deflating, they are crunchy, they're okay, there is some kind of crepitation, dilation of alveolar ducts, nothing else but emphysema. Sure, that's the correct answer. That's not pneumothorax, that's not pneumonia, that's not atelectasis. Basically, pneumothorax and atelectasis, they are connected. That's not just pneumosclerosis. Yeah, there is some presence of pneumosclerosis here, but together with that, we see the dilation and overinflation of the alveolar spaces. Just to remind you is that that's the emphysema of different types, is the comparison of the normal alveolar spaces, centroacinal or panacinal. That's emphysema without specification. Next question, an autopsy of a 40-year-old woman who had been suffering from rheumatoid arthritis. Her spleen is found to be dense and enlarged. She already started to answer the saga spleen. Yeah, sure. The key word is there are enlarged follicles resembling semi-transparent grayish-white granules, and they are composed by the amyloid masses. You see, this woman was suffered with the rheumatoid arthritis, and as a result, we see the systemic AA amyloidosis and gross appearance of this amyloidosis in the spleen. That's saga spleen. B is the correct answer. Great. The next question. Section shows significant enlargement of the patient's right kidney. There is a nephrolith or kidney stone, as you wish, at the place of incision. Renal pelvic lumen is distended with accumulating urine. Renal parenchyma, yes, so that's hydronephrosis. Perfect. The correct answer is hydronephrosis. I just don't want to take your time anymore. Let's turn to another one. A 67-year-old patient with clinical diagnosis of chronic bronchitis, pneumosclerosis, and cardiopulmonary decompensation has the biopsy material taken from the suspicious area in his right bronchus mucosa. Cellular and tissue atypism along with pearly bodies can be histologically detected. Yes, yes, yes. Metaplasia of squamous cell carcinoma. Okay, in fact, there's the squamous cell carcinoma keratinized type. Yeah, that's the squamous cell carcinoma of the bronchus is keratinization. The keyword over here, that's the presence of so-called cancer pearls. That means there is the keratinization. Without cancer pearls, we call it just non-keratinized or just simply squamous cell carcinoma without specifying. Next question, again, you see a lot of questions about the tumors. Patient has hoarsened of voice. During laryngoscopy, a gray-white larynx. Okay, you just don't want that I will pronounce that. Yeah, sure, tumor with papillary surface. And you see this tumor is pretty benign. There is no signs of the atypia, right? So what is that? It's papilloma. For sure, that's not angioma. That's also benign tumor, but it's composed of vessels. And that's not angiofibroma. Again, that's about the vessels together with the connective tissue, and neither fibroma. Polyp, that's inflammatory tumor-like process, and there is no signs of inflammation here. Okay, at least they didn't write about that. So just do not confuse us, because in fact, sometimes we can see some inflammation, but that's not polyp. Forgot about that. Just be focused on papilloma. That's papilloma. That's the correct answer. And our travel to 2017 is over. Now I just want to revise 2018. It was 22 MCQs that we discussed in part 2. Without a question, without a discussion, just remind you, it was the question about the Aschoff nodules, which means rheumatism. It was the question about renal amyloidosis, this chronic kidney failure, and dilations in the lungs, which are bronchiectasis, as you remember, honeycomb pattern. It was again, oh, that's curious. That was the time traveler from 2016. It was about the thermal burn and the opaque liquid and the boil. That's serous inflammation. It was about the deep vein thrombophlebitis, which was resulting in the development of the thromboembolism in the main pulmonary artery. 2017, 2018 question, mutual question about diffuse cardiosclerosis. You see the, in fact, that's quite interesting because you will have another question about the focal cardiosclerosis in 2020. We will discuss later. So just try to remember the difference, diffuse cardiosclerosis and focal cardiosclerosis. Here we're talking about the non-obstructive atherosclerotic plaques. At just 1/3 of the lumen, arterial lumen, is closed. And that's why we don't see any development, any signs of the acute myocardial infarction or some history of myocardial infarction in the past. So that's just about the long-standing continuous ischemic injury of heart with development of the diffuse cardiosclerosis. The very specific Ukrainian medical term, alterative inflammation of cardiomyocytes due to the diphtheria. That's just to memorize that. Alterative inflammation means the myocarditis in this case, means we see the predominance of the degenerative and necrotic changes over the exudation, over the presence of exudate or cells in the inflammatory tissue. That's question about the actinomycosis, and you remember the keywords here is the presence of druses, fungal druses. They are here. That's the keyword for actinomycosis. Then again, acute pyelonephritis. How, and you have asked me how to distinguish acute pyelonephritis and acute glomerulonephritis. Use keywords. In this case, there is the involvement of pelvis and calyces, but not the glomeruli. That's why we call it pyelonephritis, because pyelos means pelvis. That's quite easy. Question about tuberculosis and widespread injury of involvement of entire lobe of the lungs with the pleuritis. In this case, we have deal with nothing else but caseous pneumonia. So it looks like pneumonia, right? With pleural effusion. That's quite pretty easy to build the connection in this case. Nodular silicosis, because we know that we have the man who a long time had been working in the factory with a high content of silicon dioxide. Silicon dioxide means associated pneumoconiosis, silicosis. And that's nodular because we see the numerous rounded oval sclerotic foci. That's pretty easy. Silicosis, which is nodular. Necronephrosis as a result of the hemorrhagic shock, the acute renal impairment, which was conducted by the hemorrhagic shock, and the signs of that: dark red renal pyramids, pale pink cortical layers, and necrosis, selective necrosis in the convoluted tubuli, necronephrosis. Typhoid fever, in this question, it describes ulcers of 3 to 5 centimeter in diameter with the grayish-white substance and with the Vidal positive test. That's enough to set the correct diagnosis. That's only typhoid fever. And localization, that's the small terminal segment of small intestine, the ileum. That's for sure not the dysentery, neither Crohn's disease or relapsing fever. 30-year-old man with papillary carcinoma of the thyroid. That's quite easy because we have again the signs of the malignant tumor, the atypia, and the papillary structures. Don't be confused with the goiter of Bazedov, because in this case we distinctly have deal with the atypical epithelium. Non-keratinizing squamous cell carcinoma. There's the skin, and you see no presence of pearls, like we already seen in the lungs. That's non-keratinizing squamous cell carcinoma of the skin. One more time traveler MCQ, you see 2017-2018 appearance. There was the question about the abscess of the lungs, which is the consequence of the bilateral bronchopneumonia. Quite easy. We see the cavity filled with pus, yellowish-white liquid. Good question about the lymphoblastic leukemia. You see, there is no... We don't know if it's the adult, if it's the child, doesn't matter. In this case, we see the involvement of lymph nodes. We don't know about other organs. We just know about the involvement of lymph nodes, but several lymph nodes, not only one. And also we see the presence of lymphoblasts, which is the key word over here. Lymphoblastic leukemia. The others we are excluding. Neurinoma with verrucai bodies, the key word for that, and the palisade structures, the benign tumor from the Schwann cells or schwannoma. Hashimoto thyroiditis or autoimmune thyroiditis or chronic lymphocytic thyroiditis, the synonyms, and with the characteristic signs as the lymphocyte infiltration and the lymphoid follicles with the destruction of the parenchyma. Metabolic disorder of cholesterol and cholesterol ethers, which is the like biochemical definition of atherosclerosis. Sure, we are pushing from the background. We are pushing from aortic intima over here, which is injured with white, yellow protruding plaques in the area of aortic bifurcation and yellow spots and streaks. That's quite smooth form of the atherosclerotic course. Anyway, it's associated with the metabolic disorder of cholesterol and cholesterol ethers. Question about systemic lupus erythematosus is quite frequent. We already passed approximately 2 or 3 questions like that in each year. In 2018 it was 2. Systemic lupus erythematosus here is connected, associated with the wire loop thickening of the glomerular loops. So that's the connection. That's also the gender, the female, and for sure that's about the systemic connective tissue. Then endometrial cystic glandular hyperplasia appeared in 2 years, 2017 and 2018, and it's quite easy. We don't see any signs of atypia. We see the presence of cyst-like lesions, dilated glands of the endometrium, and normal appearance as the serrated glands. So that's not atypical, that's not the polyp, that's not the placental polyp, and that's not the carcinoma. That's only endometrial cystic glandular hyperplasia. Arterial hyperemia as the result of the sudden remove of 5 liters of acidic liquid. That's the quite easy. And we are turning to 2019, which we passed on Tuesday. It was 22 MCQs. We discussed it in part 2, just repeat it very quickly. There was a question about the Wilson's disease. This question is rather pathophysiological. Anyway, cerebroplasmin is decreasing as the compensation in absence of the copper, normal copper transport from the hepatocytes. That's the question about the Niemann-Pick disease, and in this case, you should answer the responsible enzyme, the anomaly of which abnormal function of which is associated with this disease. That's sphygmomyelinase, because Niemann-Pick belongs to the group of the diseases what we call sphygmolipidosis. 2017-2019 question. Acute radiation sickness, the key word here for sure, there's the nuclear submarine. There's the man who served on the nuclear submarine, and you see the complete destruction and atrophy of different tissues which are normally proliferating pretty well, like bone marrow and mucosa, and see the acute radiation sickness over here. Malaria appeared 2 times, quite easy. It was tropical country, and it was black coloration of different organs because of the formation of the malaria pigment or hemomelanin. Cushing disease with the presence of pituitary adenoma. Again, repeating, don't confuse with Cushing syndrome. In case of Cushing syndrome, we see the primary lesion of adrenal gland. In case of Cushing disease, we see the primary lesion of the pituitary gland, which is finally stimulating the function of the adrenal cortex. Question about the SLE, systemic lupus erythematosus, and immune complex mediated glomerular disease, which is lays in the basement of the lupus nephritis. It's quite easy. Again, the butterfly pattern. You just should know that SLE, the lupus erythematosus, is associated with the immune complex mediated hypersensitivity. Nephrotic syndrome, that's rather pathophysiological question anyway. Nephrotic syndrome, hyperproteinemia, dysproteinemia, and hyperlipidemia due to the severe proteinuria. Again, question about systemic lupus erythematosus, and again, the main key word here, there's the wire loops in the glomerular apparatus. Acute gangrenous appendicitis, because black color, because foul smelling, because there is the prominent necrosis. So that's why there's the gangrene. Ischemic stroke, because we see, first of all, the injury of the brain with the right-sided weakness, and you see the difficulty in speaking. That's for sure some kind of injury of the brain. But also on the autopsy, we don't see any signs of the intracerebral hemorrhage, and we don't see any signs of the abscess formation, of purulent inflammation, and don't see the signs of the cyst or tumor. That's just ischemic stroke, because there is the poorly demarcated great wide junction. Chronic lymphocytic leukemia. By the way, this question was like the pitfall. When you have trained the MCQ trainer, a lot of persons have mistake exactly at this question. I don't know what exactly was very hard to you, because you see, we got deal with 30-year-old man, right? We have deal with the enlargement of the liver and enlargement of the lymph nodes, what is really important. And also we see the cells, that's like the, finally, that's make this MCQ as a piece of cake. The infiltrates consist of juvenile hematopoietic cells with round nuclei and thin layer of cytoplasm. And you see no mention of the Auer's rods, which means they're talking about lymphocytes, lymphocyte-like cells. That's the lymphocytic leukemia. That's not lymphogranulomatosis because that's leukemia, that's the systemic process. That's not acute lymphoblastic, neither myeloblastic leukemia. And as I told you, there is no signs of Auer rods in the cells. They are rather round and with thin layer of cytoplasm. More likely, there's the chronic lymphocytic leukemia. Please try again the trainer. You must do that. Autopsy of 3-year-old child. 3-year-old child, that's keyword. The cerebellum, another keyword. The tumor without clear margins, that's the malignant tumor. And what is the conclusion? For sure, medulloblastoma. Skin cancer, patient with the gradually developed skin plaque on his face. In the center of this plaque, there is the necrotic patch and ulcer. And in the histological analysis, there are proliferation of atypical epithelial cells. The only conclusion, that's the cancer. That's about the stages of the carcinogenesis. And if we have deal with the metastasization and the growth of the tumor, for sure, that's the progression. That's like the ultimate stage of the tumor growth, progression. Proliferative granulomatous inflammation is described as the caseous necrosis surrounded with cellular infiltrate consisting of lymphocytes and single giant cells. That's it. Everything is clear. Nothing else is matching here. Krupos pneumonia or lobar pneumonia, as you wish. As usually, we see the lobar involvement in the lung. We see the pleural effusions, basically covered with the fibrinose films. And for sure, there's the Krupos or lobar or pleural pneumonia only. Fibrinopurulent peritonitis, which is characterized by not only the presence of pus within the peritoneal cavity, but also presence of the yellow-green membranous deposits. And as the mixture, we have dealt with the fibrinopurulent peritonitis. Antigen stimulation, this question appeared 2 times in 2018 and 2019. And again, they see the contact with the antigen, and we see the proliferation of the lymphoblasts, lymphocytes in the lymphatic follicles, which creates the lymph node, germinative centers, light centers. That's the antigen stimulation. For sure, that's not other options. Thromboembolism. You see a lot of questions about the thromboembolism. We have met already some variations of that, and you see this question it's a bit different. Again, we have deal with the leg deep vein thrombosis, and finally we found the thromboembolus in the bifurcation of the pulmonary trunk. Question about hemosiderosis in the lungs with the men who suffered from mitral stenosis. Remind yourself about the brown duration of lungs. It's also associated condition with that, dense brown lungs. But here the question about the accumulation of the pigment. You see the hemosiderin, the product of the hemoglobin degradation. Hemorrhagic infarction, that's the infarction, typical infarction for the lungs with the wedge-shaped contour, and for sure it's associated with the thromboembolism of the small branches of the pulmonary artery. I want to say that we already finished with 2019, but wait, something get lost. I get lost some questions. On Tuesday, it was my fault. I didn't choose that properly. I was in a rush. That's why I want to discuss about some questions from 2009, because I guess they are quite significant for you. So the first question is about the essential hypertension, diminished kidneys, small kidneys with finely granular surface and uniform renal cortical thinning. And you answering E, primary contracted kidney or primary shrunken kidney. For sure, that's primary shrunken kidney, because you have to associate this type of the small kidneys, like renal sclerosis, associated with essential hypertension. Secondary contracted kidney or secondary shrunken kidney, this type of sclerosis is basically associated with the inflammatory diseases like glomerulonephritis. but not with the essential hypertension. In this case, essential, that's the primary process. Primary process, essential hypertension, which means primary shrunken or primary contracted kidney. That's the correct answer. The second one, 27-year-old woman with the sectoral resection of mammary gland tissue. Microscopy detects a dense white node, 4 centimeters in diameter, with clear margins in the excised tissue. Immediate histological analysis showed the tumor to consist a large amount of fibrous stroma. Okay, BBB, pericanalicular fibroadenoma. Sure, we have no signs of the atypia. We see that epithelium overlays the basement membrane and retains its polarity. That's typical epithelium. And fibrostroma. Altogether, that's fibroadenoma. Strong stroma, no atypism, fibroadenoma. All others must be excluded. 9-month-old child presents with delayed tooth eruption, improper sequence of tooth eruption, and horizontal maxillary configuration, high arched palate. Microscopically, animal mineralization pattern is irregular. Animal columns are wrinkled. Some of them are vacuolated. Patented zones are okay. Everything is about the rickets. Lack, that's not hyper, that's hypovitaminosis D in early childhood. That's easy. I just see I'm highlighted in bold font only this combination. 9-month-old child and all other features of the rickets. That's early rickets. Late rickets we will rather see in the 4, 5, 6-year-old children. Early rickets. 63-year-old man who has been suffered from chronic diffuse obstructive pulmonary emphysema for 15 years, died of progressive heart failure. Autopsy shows nutmeg liver cirrhosis, cyanotic induration of kidneys and spleen. Okay. Yeah, that's B, chronic heart failure. Yeah, pretty good. That's not acute. Just exclude C, D, and E from the beginning. That's not acute. And that's not isolated atrial failure. That's the secondary process, which is secondary to the pulmonary failure. That's why in this case, we conclude the involvement of entire heart, mostly right heart, right part of the heart. That's why we're talking about the chronic heart failure, because both ventricle and atrium also involved here. Okay, patient with obliterating endocarditis has undergone a ganglionic sympathectomy. Positive therapeutic effect on this surgery is associated with development of arterial hyperemia of the lower limbs, which can be described as, you have chosen A, sure, neuroparalytic. In this case, that's like the artificial paralysis of the nerves by the sympathectomy. You see, there is the intervention into the nerves, into the nerve system. That's pretty clear. We are paralyzing a nerve system, and in such a way performing the artificial arterial hyperemia, which is pretty important for this kind of patients with obliterating endocarditis. A is the correct. And finally, we are here in this year, this damned 2020. See, with the COVID, with everything else, and there are a lot of questions. Which question you will have during this exam? I would like to think that my workshops helped you, at least, you know, I want to believe in that. Anyway, I will feel myself quite sick if I won't propose you at least some hypotheses about what may be. So now we're talking about the maybe, what may be during the Krok 1 exam this year. And as I told you, we are a little bit lucky because you already obtained the we already obtained the questions from the Ukrainian students. We can compare what they did. And what I should say that they have a lot of new questions. So the first one, that's from 2011. You see the very old time traveler, and you already started to answer. That's exactly the fibrosing alveolitis. Well done. So yes, we're talking about diffused pulmonary affection along with interstitial edema, infiltration of tissue by lymphocytes, macrophages, plasmacytes, pulmonary fibrosis, and panaciner emphysema. So exactly this MCQ in English was in 2011, and now it appears in the Ukrainian form, fibrosing alveolitis. Next question was in 2019, and we discussed about that. It was about the raspberry tongue and sore throat in a 6-year-old girl, and with a skin rash, punctate skin rash, with the fever and the submandibular lymphadenopathy. And that's for sure the scarlet fever over here. And this is the brand new question. Autopsy of a woman suffering from a chronic dysentery, diarrhea, chronic diarrhea, during histological examination of internal organs of the stroma and parenchyma of the myocardium, kidneys, gastric mucosa, lung, connective tissue revealed amorphous purple deposits, which give a positive von Cossas reaction. Perfect. B. We are talking about calcification because von Cossa reaction, that's about the staining of calcium phosphate. So that's the accumulation of the calcium phosphate in different organs and multiple organs, which is the sign of the metastatic calcification. And in this case, we have dealt with the hypercalcemia and secondary hyperparathyroidism. That's the result of the adaptation compensation to a chronic loss of the water, chronic dehydration. That's B, metastatic calcification over here. That's correct. Next question again about the old good question with another formulation, a little bit different formulation, but again with the keywords as the lymphocytic infiltration, formation of lymphoid follicles with granule center, and some injury of the follicular epithelium. Yeah, pretty well. That's what? Oh, okay. Wait, there is no Hashimoto thyroiditis. There is no chronic lymphocytic thyroiditis, but there is the synonym of them. That's the autoimmune thyroiditis, which is the correct answer over here. For sure, that's E. That's the autoimmune thyroiditis. Remember, autoimmune thyroiditis, that's the synonym of the Hashimoto thyroiditis. Next question, that's E, that's the correct answer. Next question, in a man who died of internal bleeding. Sorry, it would be really awkward and ridiculous English, but we translated very, very fast. So that's why you will find a lot of mistakes here, but that's not important. Now it's important to send you some sense of these questions. So there is a red spongy node measuring 15-10 centimeter, well demarcated from the surrounding tissue. That's the signs of the benign tumor. This see the large vascular thin-walled cavities lined with endothelial cells. So there's the vascular tumor, vascular and benign tumor. That's some hemangioma. But since we have dealt with the large vascular thin-walled cavities, which are resembling caverns, there's most probably cavernous hemangioma. And that's exactly the most common complication after the surgery, the bleeding, internal bleeding. Sometimes it's very hard to stop. Okay, 38-year-old woman was admitted to the surgical department for diffuse peritonitis. During the operation, perforation of ileal ulcer was detected. Ileum, you see, ileum, that's the key word. There are ulcers of pear patches with perforation. So what's that? What is the disease here? Yeah, we already met this disease, but here we see the ultimate complication of that, the perforation of pear patches and development of the peritonitis. For sure, we are talking about typhoid fever. You see the very good connection. Ileum, ulcers in pairs patches, and it works pretty well. Okay, that's next one is quite easy. At the patient who died of uremia, okay, there is the kidney involvement somehow, but I didn't highlight it yet. You see, there is the spinal deformation. There is the injury of the cartilages of the small joints of the spine, of the vertebra, and there is ankylosis. And you see, that's just obvious. There is no chance to answer in other way. We see ankylosis, and we see option with ankylosing spondylitis. That's bacterial disease, and that's the correct answer. Next one. 35-year-old man became suddenly sick. There was a rise in temperature to 39, was a runny nose, cough, tears. On examination, the nasopharyngeal mucosa is swollen, hyperemic, and abundant with mucus. What kind of inflammation? Very easy, right? So 2020 appears as quite easy, but please don't be relaxed because nobody knows what will happen exactly. Okay, catarrhal inflammation, sure. 55-year-old patient with an acute attack or hepatic colic was admitted to the gastroenterology department. Objectively, body temperature 38, sclera, mucous membranes, and skin are ecteric. Urine is dark, feces colorless. We have deal with which type of jaundice? Please help me. What is the name of this jaundice? Who can write it? Yeah. Any ideas? What type of jaundice? When we see the colorless feces, when we see the dark urine, and when we see some kind of acute attack of hepatic colic. Okay. It's hard to type now, right? Friday evening. But conjugated bilirubin, yeah, that's about conjugated bilirubin. Perfect. Everything is okay. Yeah, but that's obstructive jaundice. That's what I wanted to hear from you. Yeah, that's accumulation of conjugated bilirubin, and that's obstructive jaundice. Pretty well. In such a way, we have deal with obturation of the bile ducts for sure. Next question. Microscopic examination of the kidney biopsy revealed foci with granular eosinophilic masses in the center, surrounded by infiltrated lymphocytes. See, all good keywords: granular masses, necrosis, lymphocytes, pyroglobular cells. That's for sure granulomatosis inflammation. Well done. Next one. We are really close or getting closer to the end. The patient suffered a recurrent intramural myocardial infarction. Okay, that's what I already told you. That's some like brother or sister MCQ about this, but it was something different. After treatment and rehabilitation, he was discharged in satisfactory condition. You see the compensation of the post myocardial infarction condition. And finally, he died in a car accident 2 years later. What is the nature of the pathological process in the myocardium was established at autopsy? Focal cardiosclerosis. I would like to say rather large focal cardiosclerosis. So for sure, that's not the diffuse cardiosclerosis. What maybe you remember, we discussed about, then we got the non-obstructive atherosclerosis. Focal cardiosclerosis, that's the correct answer. And again, let's turn to the brain tumor. Brain tumor. Patient with rapidly progressing intracerebral hypertension. You see, there is no mentioning about the age. Okay, if you remember about the medulloblastoma, it was like 3 or 5 year old boy. So in this case, we got a patient without age. During the operation, the tumor of parietotemporal lobe, that's not the cerebellum, that's the large hemispheres, with a soft texture with varying like motley appearance on the cross section. And histologically, the tumor is composed of polymorphic hyperchromic cells with the formation of pseudo rosettes. So large number of vessels and large number of areas of necrosis and hemorrhage. What is this? What is this? D. That's D. That's correct. That's the glioblastoma. That's the histological features, histological specific characteristic of this tumor. Necrosis, pseudorosettes, and very high polymorphism. One more question. 7-year-old child, fever 39, some catheteral appearance of runny nose, conjunctivitis, and cough. Large spotted rashes are noted on the skin, and with the examination of the oral cavity, whitish rashes are observed on the mucous membrane on the cheeks. Suddenly, the dyspnea was developed with consequence to death due to the asphyxia. Which diagnosis is most likely? Who remember what is the name of this oral cavity whitish rashes? Don't remember? Okay, that's the spots of. Okay, that's kind of like a plaque, but there is the specific name of this so-called enanthema. And the rash on the mucosa, we call it enanthema. And in this case, there's the Koplik spots. Koplik spots. I will type you that Koplik spots. That's it. Okay, and we have deal for sure in this case with the measles. And Koplik spots, that's the prodromal symptom of the measles. Men with acute myocarditis died of cardiovascular failure. Microscopic examination of the internal organs revealed plasmorrhagia, edema and stasis in the capillaries, numerous hemorrhages, as well as dystrophic changes in the parenchyma. What is the cause of these changes? DIC syndrome, acute arterial, sorry, that's the mistake, not arterial, acute general venous congestion, chronic general venous congestion, general arterial plethora, or local arterial plethora. What is this? Okay, you have choose Shashank Patel C. Others? Other ideas? Oh, it's supposed to be quite hard question. Yeah, you see, A, DIC syndrome, A, Swati, A. Okay, look, in case of DIC, we will rather see the development of the, edema, not edema and stasis and the capillaries. We will rather see the presence of thrombosis, and finally so-called the coagulopathy of consuming. That's why we call it DIC, disseminated intravascular coagulation. You see, there is no mentioning about the coagulation within the vessels. Moreover, in case of the DIC, we should have some very, very strong stress factor like poisoning, systemic injury of the organs with poison, shock condition, some septic condition, like the most common cause of the DIC. Systemic inflammatory process. In our case, we only have deal with the acute myocarditis, and the most prominent pathogenesis of this process is not connected with the suffix itis. It's not connected with the inflammatory process, but rather with the insufficiency, left ventricle insufficiency, which is acute. If I will put replace the acute myocarditis with acute myocardial infarction, the result will be the same. So here, the most important thing is the acute left ventricle insufficiency, which leads, yeah, you see that's acute process, not chronic. And as a result, we have deal with acute, not arterial, that's a mistake, acute general venous congestion. Acute general venous congestion, that's the correct answer here. So Did you understand my explanation? Okay, what happened to this case? There is a very rapid decrease of cardiac output, so left ventricle doesn't contract properly, and as a result we see the acute venous congestion. Acute venous congestion, but in exam there is arterial. Then what we no, it was my mistake. As I told you, I translated these questions from Ukrainian. They doesn't exist yet in English. So in this case, you will see in the end of the meeting, in the end of the workshop, I will give you the link to the trainer. In the trainer, you will see the normal appearance of this question. I just didn't have time. I just missed to correct it. So don't worry about that. It should be acute general venous congestion. That's it. So due to the lack of the left ventricle proper work. So that's the correct answer. That's about the professional disease and pneumoconiosis associated with the coal mine. And Vedic already answered with Svati. Yeah, that's pretty obvious. In this case, we have dealt with the anthracosis. Black pigment, enormous amount of black pigment. So once again, please don't be confused. If on the first place, if the name of the industry is pronounced, so choose the same type of the pneumoconiosis. If you're talking about the silica dioxide particles or industry, that's silicosis. In this case, anthracosis. That's not likely silica anthracosis or something. You should choose the proper type of the pneumoconiosis. Anthracosis. E is correct one. On the autopsy of the body of the deceased, it was found that the whole right lung is enlarged, dense. On the pleura, there is a layer of fibrin in the incision in the presence of gray tissue from which flows turbid fluid. Quite easy, right? Lobar pneumonia or Krupos pneumonia. Okay, old good lobar pneumonia. I see a lot of questions about that. So, people, we finished today. Don't forget about the self-assessment. I just want to give you the, just a moment. I will finish the. So I want to send you the trainers. So now we got 3 of them. Try each. It's quite easy to memorize. It's quite easy to receive the feedback because these trainers will send you results immediately. So you can try more and more and more. You know, today I discussed with Dr. Elena Chomyak, I mean your deputy dean, and she just showed me up how much you are passing the trainer on pharmacology. And, you know, I'm jealous. I'm really jealous because you don't do the same here. I prepared for you this trainer, so please use them. In such a way, you will be more self-confident and you will go on a Krok 1 with the good memorizing of the MCQs. And you see, after all, there are like 82 questions from different years, from 2070 up to our current time. But as I already told you, there are a lot of questions from 2011. Now you can turn on the microphones if you want to discuss about some points. You can ask me. But I also want to give you the. I guess you already know this place. So, okay, I use Gayal. Sir, what will be the answer if urethra split on the dorsal side? Okay. Okay, epispadiasis or hypospadiasis. In this case, yeah, that's the hypospadiasis. Yeah, we see the dorsum split on the urethra, split on the dorsal side. Okay, if it's splitted at all, that's the epispadiasis. In case of the hypospadiasis, we don't have the splitting of the urethra. We have rather the some kind of deformation of the lower side. But okay, you can read about that later more profoundly. Maybe I'm mistaken. I just want to say that epispadiasis is associated with the splitting of urethra. And in this case, we are talking about this type of the injury. In this case of hypospadiasis, okay, I'm not sure, but we have to check. That's pretty easy to check. Let me figure it out. Hypospadiasis. Okay. So it says that that's a common variation in fetal development of the penis, in which the urethra does not open from its usual location. You see, in this case, we don't see at all the opening of that, in contrast to the splitted urethra in case of the epispadiasis. So that's the hypospadiasis. There's the okay, I just want to show you this image. Sorry, ladies. I just want to turn to this. Yeah, so this is the hypospadiasis. And epispadiasis, how it looks like. Yeah, that's on the dorsum. You see, there's the normal appearance. Do you see what I see? Yeah, that's the normal appearance of the urethra, and that's on the dorsum exactly. That's the epispadiasis. So yeah, so sometimes you just have to memorize the MCQs. You see, it doesn't look like was described in the MCQ, but that's the case. Hypospadiasis. Okay, that's very good image from osmosis. In fact, you see the hypospadiasis below, epispadiasis above. That's it. That's it. So now I guess that's clear. Okay, people, other questions? Do I have other questions? No. Okay. You see, indeed, I'm begging you, try the trainers as much as possible. It would be quite useful, and send this information to others. Anyway, I will upload this video in our Facebook group. You can rewatch it. You can again watch that on our YouTube. Don't forget about that. And with that, I have done what I could. Everything now is up to you. I'm just, want to wish you good luck again with this guy and the clover leaf, and cross my fingers, whatever. But so please don't fail, and do your best. Okay, we'll see how my workshops help to you. Again, if you will accomplish your exam, please don't hesitate. Write me on my messenger on Facebook and describe how it was. How was your exam? Describe how was the Especially I'm interested in the pathomorphology questions. So how it was correlated with our discussions and with our time what we spent during this week. Okay, so with that, have a nice weekend, have a nice day, have a nice evening today, and good luck on exam. So be lucky and be smart. Thank you so much for your attending. Bye bye.